Yeah. Good morning, Dr. Rashi.
Good morning, Dr. Raghav.
Yeah, so great to be with you in this conversation. You are one of the most eligible, informed partners for this conversation, being a doctor yourself, being a pathologist. You've done so well academically. You've been a gold medalist, and you are a food enthusiast as well. So it has been great to know about your knowledge about so many culinary things, and you also love eating out, trying new recipes. So I think you'll give a great perspective to our conversation. So I welcome Dr. Tashi to this conversation. And to introduce myself, I am Dr. Raghav Shah. I am an addiction psychiatrist. I've done my DM from PGI Chandigarh. And right now I'm working as a consultant psychiatrist in Rajasthan Hospital, Jaipur. So today's conversation topic for us would be eating disorders versus food addiction. Some myths and facts which need to be cleared, discussed. And the backdrop of this conversation is a pandemic, not the pandemic of COVID 19, which everybody is concerned about, but rather a slow pandemic of obesity, which in our country is becoming a problem, especially in the developed areas, metro cities, people who have higher income. But if we see towards the Western countries or other developed nations, it's already a huge problem. So,
Def-
Dr. Rashi, what would you say about obesity and food addiction?
First of all, thank you for a lovely introduction, Dr. Raghav. And definitely, I look forward to having a very friendly but a very scientifically and factual conversation with you regarding food addiction and eating disorders. So, there are a lot of myths and a lot of misunderstandings that people have regarding food addiction these days. I would say that, in a sense, how can food be an addiction? It is something that we come in contact with every day. We are having food every day. Usual things that we see that you are addicted to is alcohol or smoking. So you keep away from that. You don't do that. But food is something that we have to have every day. You come in contact with it. You can't stay away from it. You have to have food every day. So how do you think that food is an addiction?
Yeah, so that's a very interesting question because other addictive substances that you mentioned are generally not consumed in any amount. So nobody uses tobacco in small amount in foods. Maybe for alcohol, for some cultures, it's a tradition to have it with alcohol with food, but in very small amounts and not to the level of intoxication. But food, which is a staple for us, which is like a natural reward, how can it become an addiction? So here we have to understand that food as a whole is a huge category. But in this, things which are high on salt, high on sugars, and high on fat, or a combination of all three, which we commonly know as fast foods and other,
Rewarding foods.
yeah, rewarding foods, as you said so correctly. So they can hijack your brain's reward and pleasure centers just like those drugs or alcohol. So if we see in this light, food can be an addiction for some people.
Some people. So it basically triggers your dopamine release system for reward, for pleasure. And then that is how all of these junk food and the high energy foods, they work as emotional foods for people.
Yeah, so emotional foods are comfort foods, as we know. It has been a part of our culture since long that having a chocolate makes you feel good, or having just any other comfort food which you have been using a lot of times to improve your mood. But now, what happens is if this goes overboard, or an extreme of a normal behavior develops where you become preoccupied or this food specifically these comfort or these high on these specific substance types of foods, then they become a compulsive kind of a habit for you, and here's when the food addiction begins. So I would ask you, Dr. Tashi, that have you ever felt that maybe yourself or somebody you know who has had a difficulty in giving up on these foods despite a lot of problems?
I would say even I was having a lot of craving during my pregnancy for,
Hmm.
as you said, these high energy foods. I used to crave for chocolates. I used to crave for ice creams, for high energy foods, as you said. And they used to, like improve my mood, my emotional existence considerably. Like after having probably a big bar of chocolate, I would feel very nice, very nice. And just going back. I would say that that is what led to a lot of weight gain during my pregnancy, and it led to a lot of problems. So yes, one has to be a mindful eater and not an emotional eater for sure. And what are the points that you would say differentiates between emotional eating and mindful eating?
Yeah, so you have given a very good example, and this example would really help us clarify between the mindful eating and emotional eating. So, what we need to understand is that episodes of emotional eating, by episodes we mean which are like, for example, you mentioned pregnancy, where
Yes.
you would have been stressed, but that was a limited period.
Yes.
You would have overcome your pregnancy successfully and you have a beautiful daughter. We know that. So these things are time limited. And if you use foods to help you with your emotional states on a sporadic or episodic basis for some period of time, then it's very much healthy. But if this goes on, it otherwise in other situations also where you actually are not that stressed, or maybe you just need a excuse to have those foods on a regular basis, that's where one needs to be concerned. And here comes the concept of mindful eating. So mindful eating generally means that food should be an activity in itself. One should look forward to having food. One should have a lifestyle around food, a daily routine where
Right.
you actually take food being in that moment and you concentrate on food. Generally, what we have seen is in this current stressful lifestyle, people are in a hurry. They just keep on gobbling food and doing something else. So that generally takes away the experience of having food in a proper way. So one overcompensates by eating that food to have that experience. So if we are in that moment, we concentrate in our food and we have it mindfully, then I think that could be a preventive habit for preventing you from food addiction.
So are you saying that enjoy your food, but don't enjoy it too much, but also experience your food and enjoy it? It's difficult to understand.
So, putting it more simply, if you will focus towards your food while you're having food, then you would have that enjoyment
Right.
in a smaller amount of food and in a smaller period of time. But if you keep on doing something else while having your food,
While
I think to have that experience, you will keep on having more food.
So you
So,
need to
yeah.
have a set routine. You need to have nutritional food rather than emotional food. And I guess that is what mindful eating is, right? You need to follow these things in order to be a mindful eater.
Yeah. So, like just as we are discussing it, there are some questions. One of the questions is by Dr. Ashu that what about refined sugars? So, Tashi would like to comment on that. What is the risk with refined sugars about
I
developing
think
a
it can lead to a lot of risk. First of all, with my daughter, as I'm facing, it can lead to childhood obesity. So you have to be very careful with what you are giving them at an early age, from an early
yeah.
age. And obviously, as you grow older, you go into your, advanced stages, it can lead to obesity, it can lead to cardiovascular risks, it can lead to a number of problems, right? Your cholesterol is deranged, your lipid profile is deranged, you have risk of various CVS disorders, and obviously
Yes.
obesity, and your, with overweight, other problems come regarding your weight. Then you have knee problems, you have back problems, you have
Hmm.
various aches all over your body. So yes, I think eat refined sugars ultimately diabetes, early onset
Yeah.
diabetes, late onset
So
diabetes.
right. Yes. So
Yes,
the examples that you have given, they basically show that people who get into this cycle of developing an eating disorder or food addiction, they generally overlook these harms. And I think most of the people know that what will happen to them if they go on eating refined
yes,
sugars or whatever. But they still overlook these harms. So here comes the concept of delayed discounting. So in a addictive explanation for a pattern of food consumption, we need to understand that harms which can happen later, maybe months, years later, are subconsciously overlooked by a person who has developed this compulsive food eating habit in the favor of immediate gratification that happens when you consume that food. So, although the harms are evident to people, sometimes people don't know they need to be educated. But as they occur late, people choose to get the pleasure first, and this goes on.
and also because I think food is such a harmless thing that you think, You
Hmm.
sort of condemn people who have addiction to different substances, as you said, like smoking and alcohol. So you tend to stay away from it. But
Yeah.
staying away from food is very difficult. Staying away from good food, bad food, cooking yourself, it's such an easily available, thing. Even junk
Yeah.
food is available. So it's so difficult staying away from it. How do you curb it? And also because I
Definitely.
think it is more of a westernization of our culture that has led to these problems, I guess. What is your take on that, Dr. Raga? I think
Yeah.
earlier the problem was not in India, is it?
So you take raised two very important issues. One is how to stay away from food as compared to other addictive substances, and second is the question about westernization. So I'll take your second question first. So with westernization, what has happened is that mass production of food items has occurred, and somewhere the industry wants to push in those food products which people would love to have, in fact want or crave to have. So you can see that at the level of mass production, most of the things which are being advertised are unhealthy, or the things which are rich on salt, like those potato chips, or rich on sugars, like chocolates, or even those colas and other things, and high on fat, like all these fast foods, because they generally become a habit very easily. And if we compare it with Indian foods or our traditional foods, they are generally not packed densely with these addictive food things. So, like a paratha or maybe a poha, all those kind of things, they generally don't generate that kind of craving. Ki I've had three parathas, I'll have two more. But a person who has had three chocolates can have two more. So that is it. And the first question was that how to stay away from food. So
Easily
one
aware.
needs to understand that as compared to other addictions, like if you have a smoking addiction, the advice would be to quit, to abstain, because we
Yes.
know that it is not something which is essential to life. If you don't smoke, you will not die. But with food, the gray areas develop. Okay, how can I totally give up on food? If I
Yes.
give up on food, which foods I can give up on? So then I think we need to understand a concept similar to glycemic index for people who are given advice for diabetes. That some things are on the top, like refined sugars, 100 glycemic index. And then there are things like broccoli, cabbage, which have 10, 15 glycemic index. So similarly, we need to understand that the foods have a range. And rather than giving up totally, it's like giving up those culprits. Yeah.
So you basically
And
have to decrease your total calorie intake, and these refined sugars and all of these colas and your chocolates and your high
yeah.
salt, they are bad for you. They have high calories,
Hmm.
and so they should be just avoided. Yes, I would
Yeah.
like to
As far as.
point out that yes, my mother mentioned that earlier we never used to have XL, double XL, triple XL sizes in clothes.
Yeah.
But nowadays, all you see is it's very difficult to find a small and an extra small, but it is very, very easy to find an XL, a double XL, or a triple XL, clothing in every
Hmm.
brand, every shop that you go to. So definitely, this is because of the westernization of our generation.
Yeah, of course, because what we need to understand is the mass media, the advertising campaigns, they are designed to influence us, and they are influencing us. So I have nothing against people who are overweight and that they should not consume the media space, that advertising should not be done with a focus on them. But we also need to push those advertisements which promote a healthy lifestyle, although a lot of them are there, but I think more of a balance, a tilt towards the healthy lifestyle is required in advertising, maybe. And I have a question for you also. So, what I would like to ask you is that, you have been a clinical doctor since so long. So, have you actually come across a person whose obesity or maybe excessive food intake you cannot explain on the basis of emotional eating or any other thing? You somehow felt that he is consuming food just for the heck of consuming food.
I would say that yes, definitely. Not even as patients, but also as friends,
Hmm.
as family members. Yes, I have come across as people who don't have any emotional or probably physiological or personality issues, but yes, they are just eating food because of, as you said, because of the rewarding
Hmm.
behavior of certain high energy foods. So now
Yeah.
I want to ask, is this the difference? What is the difference between your eating disorders
Hmm.
and your food addiction, or what, are they interchangeable? Are they one and the same?
Yeah. So, first of all, we cannot call them interchangeable. Food addiction is a new concept which is being developed as a diagnostic entity for future. Not a very delayed future, I think some years maybe. But eating disorders are an established entity. So, eating disorders are basically of three types. One is anorexia nervosa, which we all know, which we have seen a characteristically low weight person who still somehow has a wrong self image that he or she has a greater weight and needs to further reduce. So we that's about anorexia nervosa. Then second is about bulimia nervosa. So while in anorexia people generally have a low weight and still have a issue with it and want to reduce it further somehow because of disturbed self-image. In bulimia nervosa, it is more about impulsive eating episodes or uh, periods when a person eats a lot of food, but then he has an image with his weight or self worth, and then they indulge in compensatory behaviors like they would gobble up a lot of food and then try to vomit it out or try to excessively exercise or purge or whatever to compensate for that. So second is bulimia nervosa, and the third is binge eating disorder. So in binge eating disorder, generally the psychological component is not very huge, that a disturbed self-image or a lot of emotional issues, but it is more like an impulse control issue where there are repeated episodes or binges of just gobbling food. A person who is doing that himself somewhere realizes that he is doing it, but just not able to stop. And then there is a guilt about excessive food consumption, but not excessively about the self image. So the eating disorders, the three types that I have discussed, they are more like a psychological or psychiatric disorders with a lot of metabolic or body involvement in terms of weight, in terms of hormones, in terms of general immunity, because as you lose a lot of weight, all these things, and even excessive weight gain. But in eating disorders, the binge eating type, especially, and bulimia nervosa, they can lead to overweight, while anorexia is a condition of underweight. While in food addiction is on a different spectrum. It's almost like the addictive disorders, where the main problem is about the compulsive food consumption. So, to explain to you, by compulsive, we mean that we have a urge to consume food continuously and we are kind of fighting it out. We are distracting ourselves, doing some other things, but as soon as we are free, this becomes our predominant motivation and we find reasons to consume food. We cannot explain it by emotions, stress, or just being tired or any other reason. So, like in other addictions, here food becomes the reward over and
The,
above all rewards and becomes the primary problem itself.
so
Yeah.
you're constantly uncomfortable, you're constantly craving food, you're physically, emotionally wanting food.
Yes,
That
yes.
that is a bad state to be in. That is, I
Hmm.
would say that when I am very hungry, I get very irritable sometimes. I tend to say things which I should not say. I tend to lose my temper more easily. So
Hmm.
definitely not a state that one should stay in, and it is definitely if not a disorder, then at least, but there should be awareness regarding this.
Yeah. So here comes a myth which I would like you to clarify.
Yes,
So
yes.
are eating disorders or food addiction more common in women? What do you think?
I think it's a complete myth. I is it? I mean, you are more qualified to answer that, but
Yeah.
definitely there are difficult periods during your monthly cycles also, and during pregnancies also, and I think that is how the myth has developed. That yes, it is more
Hmm.
common in women, but I feel that there is. I don't think there is any basis for that, except for these two things that we are talking about. I think it
Hmm.
should be extremely common in men as well.
Yeah. So here, anorexia specifically, and to some extent bulimia, they are more common in women because they are
Self-image.
associated with a lot of
Yes.
self-image, body weight issues, and we have seen that in the cultures, most of the cultures around the world are more favored towards men. So here, the psychological issues take greater prevalence. So here, these are more common in women, but compared to that, binge eating or food addiction, I would say that it is nothing like they are more common in women. Men are equally on the
Now,
go.
I would like to ask a myth to you. Does it have genetic links? Does this have genetic ties? This food addiction and eating disorders?
Yeah, they do have genetic links, but as in other psychological issues like depression is also more common across generations, bipolar disorder, these are multifactorial. So while you have a genetic risk, but it needs that kind of an environment where this thing can develop. So genetic risk is there, but not without the environmental risk.
Okay. Secondly, I would ask you, you have to bust this myth as well. Is food addiction the same as loving food? Because we see a lot of Insta feeds also regarding food porn nowadays, as this is called. People are there are a lot of feeds about how to make food, and that gives you pleasure. But is where is the line between loving food and food addiction?
Yeah. So there are three words. It's like loving, liking, loving, and wanting. Okay. So liking is a very common thing. I like to go out. I like to have food. Like generally doesn't overcome other likes. It exists along with them. Loving is a step further, that you love something in preference of other things, but not at the neglect of other things. And then comes wanting. So wanting means that you have a need. You
Need.
want that at the expense of other things. So you want food at the expense of your work. You can sneak out to have that burger. You want food at the expense of your relationships. You
Yes.
lie to your partner and have your food craving
Yes.
satisfied with a chocolate. So
Yes.
wanting is that thing. So loving is a totally harmless word. But wanting, one should understand
Like
it develops.
needing. Yes.
Yeah.
Yes. Excellently explained. Yes.
Yeah.
And is this a myth that food addicts are mostly or only attracted to junk food?
Yeah, so this is not a myth.
This is not.
Basically, yeah. So food addiction as a concept revolves around that chemical substance in the food. For example, in tobacco, there are so many things, but then there is that thing called as nicotine. If
Yes.
one can develop a tobacco without nicotine, then hardly anybody would be addicted to it. So food can have a lot of things, but this core of high salt, high fat, high sugar is what drives you to addiction. So that is not a myth.
Yes. And obviously, we have already discussed that yes, food addiction is related to westernization in our culture. That is how it is related to. Now, but is it a myth that food addiction in itself is not a disorder? It doesn't come in your list of disorder, or is it a disorder? Is it a psychological disorder?
Yeah, so food addiction is currently not as a diagnosable disorder as per the
Yes.
international classification of diseases. But if we see the trajectory of developing the concept of food disorders, I think in the further revisions to come, this would come as a diagnostic entity. So I think we should not wait to develop those harms until it's a diagnosable
And
disorder.
that only obese or fat people are food addicts, but not thin people or healthy people.
Yeah, so this is a big myth. So generally, it's not like only fat or obese people are addicted to food. In fact, obesity can have many
Right.
other reasons other than food addiction. But food addiction equally affects people who are normal weight also. And we can see that they are doing a lot of compensatory behaviors. Uh, for example, people are exercising a lot in a loop to sustain their unhealthy eating habits. So if they could decrease their unhealthy or addictive type food eating habits, they might not need to exercise to that extent. So being a normal weight doesn't rule out being a food addict.
Being normal. Okay, so these were some myths and some facts that we have discussed regarding food addiction. Now I
Yeah.
would come on myths and facts regarding basically our eating disorders, which are diagnosable, like
Hmm.
psychological disorders.
Yeah.
So, are eating disorders a choice? Can you treat it yourself? Can you sort of, do the treatment yourself and you can choose not to have an eating disorder?
Yeah, so this is almost like other psychiatric disorders. They are generally not a choice. They are a product of a lot of things like your mental functions, thinking, personality, your surroundings, the stresses that you have in your life, the relationships, and finally your self-image about
Yeah.
weight. So one should be empathic to persons who develop these disorders as they are not their doing. and they do need help. Maybe the help might not be in terms of medicines or psychiatric treatment, but they definitely need psychological or support in terms of help.
And next myth that I have received from a query is,
Yeah.
do you think that you can tell if somebody has an eating disorder just by looking at them, just by seeing their physical characteristics?
No, this is actually a myth because eating disorders are a biopsychosocial disorders. They involve your psychology, your bio, that is your body, and your social spheres. So just by assessing the body habitus, underweight, overweight, we cannot comment. We need to talk to that person.
You need to talk.
Yeah.
Right. Coming to the next question, do negative media influences like Instagram, maybe
Hmm.
post on Instagram, Facebook, as we are, like a lot of influence of Facebook, YouTube, do these negative media influences can also lead to eating disorders?
Yeah, so negative media influences do have a role in the developmental years of one's life. Generally, these negative self images are also derived many a times through the stereotypic image of a female or a male depicted in the media. So they do affect.
They do affect.
Yes.
And is it a rare concept? Is eating disorder a rare concept, a Western concept that we don't see in India? That
No,
is,
no, it is. So this is a very important question. It is not a rare concept at all. In fact, what is happening is that we are not aware about the eating disorders and the problems associated with them. Just to tell you the extreme of it, anorexia nervosa has a very large association with self-harm and even completed suicides. So we are not aware. So we are not. Our informed mind is not informed. So eyes don't see. That would be the better thing to say. But they are not rare.
they are not rare.
Yeah,
Okay.
very nice.
Know any famous personalities except for obviously Princess Diana who have been
Yeah.
affected by these eating disorders?
Uh, actually, I came up with that name only. You have a good knowledge. Actually, I was thinking of her only. But in terms of other famous personalities,
I
um,
think Kangna Ranaut also. There was somewhere, that I had read somewhere that she also had anorexia nervosa.
yeah, she might be having in her past, but currently looking to her, then again we'll make that mistake of looking at her and diagnosing. So
Yes.
maybe, maybe right.
True. And is it a serious disorder, or is it something that can be controlled by just family intervention and by making a choice of being better?
No, so these are serious disorders because not just the harm to your bodies that you do by being underweight or excessively weighted or these compensatory behaviors like purging and other things, they affect your psychology and then they affect your interpersonal relationships and your social spheres. So, in a way, a person is at risk for so many other psychiatric disorders when they have these eating disorders like depression, bipolarity, anxiety disorders, and the rate of self harm is much higher in these people as compared to others. So, we can empathize. Self harm is like that red flag that a
Red,
person is distressed.
distressed, depressed.
Yeah.
Also, how do you go about the treatment and what are the recovery options of eating disorders? Can it be completely curbed? Does it go away completely, or does it stay and it is a lifelong, thing that you have to deal with?
Yeah. So these disorders generally are long-standing disorders. People, if diagnosed early and maybe in their teens or adolescents and those times, there is a lot of scope for intervention because in developmental ages, people are responding well to psychological or cognitive behavioral interventions as well as lifestyle interventions. So, simply speaking, easy to change when you're young. But as they go on, they become more solidified or encapsulated in persons and complicated by so many other things like physical problems, depression, other things, then they can be a long or maybe a lifelong process for some people. So we
Is
should
it
be prompt.
They should be promptly taken care of.
Yeah.
And is this more serious, or is it more easily fought off than probably a alcoholic addiction or smoking addiction? or is it easier to fight off a food addiction?
So food addiction can sometimes be even more difficult to fight.
Food-
Yeah, because having something at reach
Naturally.
generally induces a lot of craving. Let's take
Yes.
for an example, when we travel on a flight to US, maybe it's 12 hours, 16 hours, whatever, we can do without smoking because we know it's not available, it's not allowed. But in terms of food, it's available everywhere, easily at reach, not looked down upon people, nothing illegal about it. So, living in the midst of cravings of food and giving it up is difficult. Like here, I would ask your opinion. If you had to give up any bad habit, I'm not saying you have a problem with food,
Yes,
but
yes.
if you had to give up any bad habit, what would you prefer? Totally avoiding it for a few days that I don't want to see this thing so that I don't indulge in it? Yeah, you would want to test your confidence that keep it beside me, I will not have it. What would be your choice?
I don't know. I don't think it can be like such a challenge like all of these, like, probably like a Dalgona challenge that, okay, this is a challenge, just keep it in front of you, but you can't have it. It's very difficult. Everything needs to be in a moderation. Only then I think
Yeah,
can be achieved.
yeah, definitely. And one more question to you would be: Have you having a lot of comments? The Keira Knightley is being mentioned as a person who has suffered from
Yeah.
these eating disorders.
Yes.
So yeah, our audience is quite well informed.
Our audience is informed. Yes, but
Yes.
it is not very, I think, well discussed in India. That is why we don't know of many people
Hmm.
who are suffering from eating disorders in India. We know that yes, it has become a cool concept to discuss depression now because of Deepika Padukone, but
Hmm.
nobody has discussed food addiction and eating disorders as of now. So yes, thank you for putting so much of light on this very very difficult topic. I feel because there have been lot of myths, lot of gray areas surrounding this. When
Hmm.
does food loving become food addiction? How do you stay away from it? How do you go for mindful eating rather than
Yeah.
emotional eating? Yes. So, is
Yes.
there something that you would like to summarize in the end about tips on how to avoid emotional eating?
Yeah. So, first of all, I'll say, Dr. Tashi Narula, you have been a wonderful partner in this conversation. It has been a very informed, as you had mentioned at the outset, a very scientifically informed as well as a fun conversation. And I can see that maybe your work is just around the corner. You're at your diagnostic center in Rohtak. So, will not take much of your time. But at the end, I would just like to say that emotional eating is kind of a step between developing these addictive food habits or eating disorders. So one should be aware that food is for your health, but not for altering your moods. So indulging it in few times to alter your moods is fine. But if you regularly start using food or just like using food like alcohol, that I'm very stressed today, I should have a stronger drink, or I'm very stressed today, I'll have a huge burger. So those kind of things one should be definitely be aware. And just at the last, I would just say that these are serious issues for some people. So while we generate an awareness for this, we also aim to help people overcome that stigma and come out in open. And if they cannot utilize self-help or maybe a psychological counseling, then they should go a step further, seek medical treatment because they can cause a lot of problem for some people. So, with this, I would be thanking you again
Thank
for this
you. Thank
wonderful.
you, Dr. Raghav. I mean, it's
Yeah,
always good to have a conversation with a
yeah,
psychiatrist rather than a general public because, then you have so many things that need explaining, that need proper defining. That yes, this
yeah,
is this and this is this, which is only achieved when you have a very scientifically based conversation, very fact based conversation.
yes. And at the last, it's a question for you and me both. Then we end. What are you going to have after this?
Oh, I am part Punjabi now. I'm going to have parathas. Yes.
Okay. So I look forward to having a kachori after this. Thank you so much. Thank
Thank
you.
you.
Yeah.
Thank you. Bye bye. Thank you so much.
Bye. See ya.